Hello everyone, a very warm and pleasant welcome to you. Today, I, Sheetal Prajapati, student of Dr. Harisingh Gaur University, is going to present my presentation on the topic Mechanism of Innate Immunity. First of all, we should know what is immunity. Immunity is referred to the resistance exhibited by the host towards injury caused by microorganisms and their products. In our day-to-day life, we came across many microbes and bacteria through different means like through air, water, anything that comes in contact to us. There are certain microbes which are harmful for us, so our body needs strong defense system against these microbes. Our body have two types of defense against infection, and those are innate immunity and adaptive immunity. Innate immunity is the one which we get from our birth, like we have skin, we have mucous membrane, etc. Adaptive immunity is the immunity that we acquire from our outer environment, which we didn't get from our birth. Moving on to the next slide, we have a short introduction to innate immunity. The innate immune response is the body's first line of defense, and it includes physical barrier and non-specific cellular barrier. In physical barrier, we have inside and outside barriers. The skin behaves as an outside barrier, and the mucous membranes of digestive, respiratory and genitourinary tract behaves as an inside physical barrier. The next point is non-specific cellular and physiological responses. They are inborn responses. They are general response to the presence of pathogens that breach the body's physical barrier. It eliminates the vast majority of pathogens that gain entry. It is independent of prior exposure of the pathogens, and its response is immediate. Here we are going to discuss different key features of physical defenses. The first and the foremost physical defense is our skin, from which our whole body is covered. Our skin is the first physical barrier that prevents our inner cells and muscles from dust and harmful pathogens attacking our body. Some key features of skin that makes it defensive is its dry acidic surface, multiple layer of tough yet dead keratinized cells which resist the growth of microbes. However, it also prevents our body from infection. It is generally advised by our doctors and parents that you should take bath daily, just because this can help you preventing your body and skin from the infection caused by dust particles and other pathogens which stick to our skin from outer environment. Another organ that behaves like physical defense system is eye. In this slide, we will come to know how our eye prevent us from microbes. We know our eyes contain tear gland, or we can say lacrimal duct. So tears continuously released by lacrimal duct contain antimicrobial substances which helps to wash away any microbes or debris present on our eye surface. Coming up to the next page, here we will come to know how mucous membrane shows preventing quality from pathogens attacking the internal body system of living being. Generally, mucous membrane is a slight slippery and sticky layer of epithelial cells covering inner parts of stomach, mouth and other internal organs. Let's take an example of our own stomach. Our stomach contains high level of HCl, which not only helps in digestion of food, but it also helps in killing the harmful microbes which are infecting our body and causing disturbance in the metabolism of our body. Now next, we have different factors which are influencing the level of innate immunity. The first one is the age factor. Very old and very young people are more susceptible to infectious disease. Like hepatitis B virus infection is asymptomatic in newborn as it lacks developed immune mechanism to express the disease. Thus, it is said that we should take more and more care of a newborn baby so that it can be prevented from any harmful or deadly disease. After age, we have hormone factor. The increased level of corticosteroid in our body can decrease the anti-inflammatory effect, which can cause severe inflammation in our body, which is not at all good for our health. The next one is the nutrition factor. In nutrition, we have immune response, and in this, the immune response is reduced in malnutrition patient. Thus, it is said that you should take a balanced diet, and a healthy body is more important for the healthy living. Moving further, we come across mechanism of innate immunity like epithelial surface, antibacterial substance in blood and tissue, microbial antagonism, cellular factor in innate immunity, inflammation, fever, and acute phase protein. In epithelial surface, we know it's the first line of defense. Our body is covered by epithelial cells, which is one of the mechanical barriers. Healthy skin shows bactericidal property like high concentration of salt in drying sweat, sebaceous secretion, long chain fatty acids, soap's contribution. All these factors help in reducing growth of pathogen. Now in respiratory mucosa, it is some of the innate mechanism of defense like nose anatomy. It prevents the entry of microorganisms and dust particles. In mucous lining, it swept back to pharynx. Mucopolysaccharide sticks microorganism to the lining. Pulmonary alveoli help in phagocytosis of cell. Then we have mouth. We have saliva, digestive juices, high acidity of stomach. All these are helpful in killing the bacteria just because they also contain antibacterial substances in them. In conjunctiva, it shows flushing action of lacrimal secretion, and it also shows antibacterial substances like lysozymes, which kills the harmful microbes infecting our eyes. In urine, the flushing action is through urethra, and the microbes and pathogens are itself killed due to the high acidity of the urine. Then here we have antibacterial substances present in blood and tissue. There are several substances having antibacterial properties are present naturally in blood like beta-lysine, thermostable substance active against anthrax and related bacilli, then basic polypeptides, leukins from leukocytes and plaquenins from platelets. Lactic acid is present in muscle tissue and inflammatory zone, and interferons are activated against viral infections. Next we came across cellular factor in innate immunity. The first one is phagocytic cell like microphages and macrophages that ingest particulate matter and microorganisms in response to chemical mediators of inflammation. Depletion of this cell can cause enhanced susceptibility to infections. Next one we have natural killer cells. It's a class of lymphocytes, non-specific defense against viral infection and tumor. Moving on further, we have inflammation and fever as another mechanism of innate immunity. Inflammation is the most important non-specific defense mechanism. All the series of events occurring in inflammations plays a vital role in killing or inactivating microorganisms. Let's take an example of bee. When a bee stings us, the particular area gets swelled up. It's just because when a stimulus is given to our body, in response, the body cells shows their responses by swelling up that particular area. Next we have fever. It is a natural defense mechanism in which the rise in body temperature is very common. It accelerates the physiological processes, destroys the infecting pathogens. It also stimulates production of interferons. Next we have acute phase protein as a mechanism of innate immunity. Sudden increase in plasma concentration of certain proteins, collectively called as acute phase proteins. It activates alternative pathways of complements and interferons pathways. It also enhances host resistance, prevent tissue injury, and promote repair of inflammatory lesions. In this presentation, we have learnt about what is immunity, different types of immunity, introduction to innate immunity, types of innate immunity, and different mechanisms of innate immunity. That's all from my side. Thank you for watching. Hope you understand the concept related to innate immunity.